Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look into some important serological tests in the parasitic infections. So to begin with, the serological tests are helpful in detecting the surveillance of many protozoal and helminthic infections. So it helps in detecting many protozoal as well as the helminthic infections. They are divided into two types. One is antibody, other is the antigen. So let's first look into the antigen. So here in antigen you have the galactose lectin antigen. So galactose lectin antigen, this is done for the entamoeba histolytica. Then comes the Giardia specific antigen 65. This is done for, as the name suggests, for the Giardia lamblia. Now the WKK and the RK39. So WKK and RK39 is for the Leishmania donovi. Next, for the Plasmodium falciparum, it is going to be the HRP2 antigen. Now moving on to the vivac specific PLDH. So vivac specific PLDH, this is nothing but the Plasmodium vivax. This will be for the Plasmodium vivax. And the 200 kDAG and the OG4C3 antigen. So this is for nothing but the Wucheria bancrofti. Now let's move on to the antibody detection. So here in antibody detection you have the complement fixation test. It is known as the CFT. Then comes the indirect hemagglutination test, IHA. IFA, there is a fluorescent antibody test, indirect one. Then the rapid immunochromatography and also the ELISA test. To learn and grow daily like this, please do subscribe.